welcome to Webinar Wednesday. This is a training that's being provided by NASCASP as part of the Weatherization Plus Health initiative. This afternoon's webinar, Promoting Integrated Service Delivery Through Weatherization Plus Health, will be presented by Tom Carey, Director of the Weatherization Assistance Program for New York State Homes and Community Renewal, and Mary Giannetti, Director of Energy, Housing, Nutrition, and Wellness Division for the Montachusett Opportunity Council. Before we get started today, I'd just like to briefly go over a few housekeeping rules. All of the attendees on the line today are on mute. If you have any questions during the webinar, you will have the capability of asking those questions using the chat option in the webinar toolbar. We do ask that you would direct all of your questions to the organizer, who will then ask your questions to the presenters on your behalf. In order for us to keep to our schedule, if we don't have time for all of your questions today, we will respond by an email following the webinar. There will be a link to the PowerPoint as well as the recorded webinar shortly after today's webinar. So at this time, I'm going to turn things over to Ryan Ward, who is the research analyst for NASCASP, and he's going to talk just a little bit about the initiative in this webinar, and then he will introduce the panelists for today. Ryan?
Thanks, Raymond. I want to start off by thanking all of the attendees on the line for listening in on this webinar. Your attendance is important because we all recognize that funding for weatherization and other health and housing programs is tight right now. And one of the ways we're working to change that dynamic is by arming agencies with information to allow them to build capacity to expand their programmatic goals. By working with other programs with similar client bases and complementary objectives, whether it be through improving the health of low-income clients, reducing energy burdens, or improving the housing stock of low-income families, weatherization providers and providers of other complementary services can show how they go above and beyond the mandates of their individual programs, and thereby highlighting the creativity and innovation within each of our networks. Now, this is not a suggestion to circumvent these mandates either, but rather to fully recognize the benefits that weatherization and other health and housing programs bring to the table, and to align those services when possible and when needed. This type of approach can result in multiple benefits for clients and agencies alike. For example, if you're able to secure resources for weatherization clients to correct health and safety issues that would ordinarily result in a deferral of services, this reduces administrative costs of going out to a home, auditing it, and then not being able to actually perform the weatherization work. And securing these additional resources also helps clients in multiple ways, including making the home healthy and safe as possible, which could potentially prevent future hospitalizations, or reducing energy burdens as much as possible, allowing clients to spend that money for other home necessities, such as medicine or groceries. So knowing the benefits of an integrated service delivery, we did want to provide a couple of different perspectives on the webinar today. We have on the line two panelists, one of whom is a state weatherization assistance program director, and the other who oversees a local weatherization assistance program agency. We hope that their perspectives and efforts to integrate complementary services for low-income families help spark ideas for a similar approach in your communities. As always, reach out to us if you have any questions following this webinar or during the webinar. NASCASP is here to help, so feel free to use us as a resource. So without further ado, I'd like to introduce our first panelist, Tom Carey. Tom is the Weatherization Assistance Program Director at New York Homes and Community Renewal. For more than 25 years, he has worked with nonprofit agencies on housing rehabilitation, energy conservation, and building sustainable communities. Since 2011, he has represented New York on the U.S. Department of Energy's State Energy Advisory Board. He is also active with several local community planning organizations. Most recently, he led in the implementation of New York's $400 million Recovery Act initiative, which provided energy efficiency measures to more than 72,000 housing units across the state. Tom holds a master's degree in urban planning from the State University of New York at Buffalo, and is a member of the American Institute of Certified Planners. So now I'll go ahead and hand it over to Tom Carey.
Okay, thank you, Ryan and Raymond, and thanks to NASCASP for hosting this series. I'm going to talk a little today about just briefly our agency and how our weatherization program is, fits in with our agency's mission. I want to cover a few things on housing conditions in New York. We have an old and challenged housing stock, including certain health and safety issues that we commonly face and that I think many of you in other states may also face. We're going to cover how we've tried to align resources to address health and safety concerns in the building stock so that we can more efficiently serve the clients we try to serve. Of course, we'll talk about some models for integrating service delivery. I want to include a brief discussion about rental housing. I think there's some challenges that are a bit unique to rental housing that should be considered. And then I'm going to end with a case study on the Buffalo Green and Healthy Homes Initiative, a good example of aligning a Healthy Homes initiative with weatherization. Okay, Homes and Community Renewal is New York's housing agency. We generally preserve existing housing, supervise our state's stock of public and assisted housing. We fund development of new housing through programs such as the Low-Income Housing Tax Credit and our Housing Trust Fund. And we are committed to revitalizing communities. Our agency, through a different office, also administers programs like Community Development Block Grant. We have the advantage of having a lot of other housing resources in our agency, but our state still has tremendous needs, and the delivery of these programs can be somewhat fragmented. We do have a long history of doing this. You can see we've, the agency, one way or another, dates back to the 1920s, and we've got a good track record of innovations and of successfully completing initiatives like this. However, we are one difference between some of the other weatherization programs is we are located in a housing agency. Our agency is primarily housing, not an energy office or other human service agency. Our program is located in HCR's Office of Housing Preservation, which supervises our affordable housing portfolio. We administer the Section 8 program. We oversee the state's public and assisted housing, and we have the weatherization unit, of course. We also coordinate with our agency's other offices. I mentioned that the Office of Community Renewal has the CDBG program. We also have administered the home program and several state housing rehab programs, including disaster relief for areas affected by Hurricane Sandy, which is a big focus of our agency right now. And our Office of Finance and Development is primarily concerned with development and preservation of multifamily housing. Our program subgrantees are typically community action programs, especially outside of New York City and our larger urban areas, and community development corporations in the city and in the Buffalo area primarily. We've administered weatherization for about 17 years now, and during that period we've assisted more than 600,000 units, so we've had a pretty robust program. We have good coordination with our the other offices within our agency and the other programs that our office administers. And we've used, for example, weatherization quite a bit to support assisted housing. Our subgrantee network is also very strong and experienced in this area, but we've got the big challenge, I think, right now, of course, is the funding level, which I'll touch on. Before I do, I wanted to shift to some of the housing conditions in our state. New York has the oldest housing stock in the United States. That's a result of being an older state and not having the level of investment over the last several decades that faster growing areas have had. We have a total of about 8.1 million housing units in our state, and only 42% of that total is single-family detached housing. So that's nearly 5 million units that are in multifamily buildings or row houses or other types of housing. Fully 70% of our housing stock was built before 1960. So it is an old housing stock, and with, as you probably know, older housing requires maintenance, develops more problems. Sometimes systems in older housing become obsolete and need to be replaced. And in fact, about half of that housing, over 2.7 million units, were built before 1940. So those tend to be, I mean, some of it's beautiful, but they tend to be our biggest challenges. On top of all that, we have the country's second highest energy costs, particularly our electric costs here are very high. About a third of our state's housing units heat with oil or electric, which also adds to the cost. And if you've ever spent a winter here, we have a cold, wet climate, which leads to a lot of moisture issues. And that seems to have become more pronounced over the last several years. Then finally, we have a very high incidence of lead poisoning and units with lead hazards. Outside of New York City, most of the housing is wood frame. It's old. That combination often means lead. So we have housing, of course, we have plenty of housing that looks like this. It might be what some of you think of when you think of New York, and this. But we also have a lot of housing that looks like this, or even this. Even though only about 2% of our households live in manufactured housing, that's still more than 80,000 manufactured housing units, and some of those present, some of those are just in really rough shape, especially in our rural areas. Okay, I want to focus just for a minute on moisture and lead. This is kind of my take on this problem. I don't really have data to support this, but my observation is that these are the two big health problems in our housing stock. They are the issues that most frequently lead to deferring work. They're costly to deal with, and there quite often are just no other resources available. So often we'll have an application to provide weatherization assistance to a building and be unable to do that because of severe lead hazards or moisture problems that are beyond the scope of our program. And then also quite commonly we will we'll be able to go ahead and install weatherization measures, but have to deal with moisture and lead issues in the course of that work. New York State has the fifth highest incidence, kind of typical of the northeastern New England states. As I mentioned, we have a wet climate. It's become worse lately. We've had some several very severe storms over the last few years, and pretty commonly accepted that our climate, at least here, has changed, and that those storms were at least influenced by that change. We mentioned we defer many units due to lead and moisture issues, and just typically it's very difficult to identify other resources, and the other resources that were available in the past few years, there's actually fewer of those as well. Here's a chart showing the incidence of lead poisoning. This actually came from the Boston Globe, so it's got Massachusetts highlighted. I'm giving Mary a little plug here, I guess. But you can see that New York and Massachusetts are both among the states with the highest incidence of lead poisoning. Here's some of the just a few photographs of some of the moisture issues we've seen in units that we've been involved with. I'm not really going to speak too much about what some of the technical problems this causes, but certainly moisture, I think many of you know, can lead to mold growth and other problems, both structural and health issues, and just certainly complicates our job when we try to install energy measures in these units. Okay, in terms of resources, our funding, I'm not sure if everyone on the phone is aware, our funding for this program is really, it's a shame how much it's been reduced. We had the large ERA initiative that ended last year, really pretty much by the end of 2011. That work was completed in New York State. We were a little overwhelmed by it, but we had a total of $400 million, almost $400 million through the Recovery Act. But also our regular program funding has been cut sharply. Our program is funded both by the Department of Energy and the Low-Income Home Energy Assistance Program. We get a set-aside of the state's allocation of LIHEAP every year. And together, those two funding sources are down more than 60% since 2009. So just our general resources to begin with are low. To make matters worse, other programs that could help with healthy homes have also been cut, especially home and CDBG, which are the two biggest housing rehab funding sources for us. And private funding has always been limited or non-existent. So I don't mean to paint too much of a doom and gloom figure, but that drives us to try to find ways to make the most of what we've got. And one of the things that as a result, we think that it means that coordination with other programs is actually more important than ever. It's the effort that will that will lead us to make intelligent decisions with those scarce resources and try to best serve the households and the buildings that we're in. Here's a chart that shows our funding. You can see, as I mentioned, it's been a little bit up and down, but this year, and that's estimated because we're still not entirely sure what we're still not entirely sure what our DOE funding is going to be, but our best guess, or our most optimistic, is still a cut. I did want to. I'm going to go back a slide just for a second. On coordination, in the past, we administered the home program and a couple of state housing rehab programs out of this office. We've restructured since then, but when we had home, we encouraged formal coordination between weatherization subgrantees and local home programs, typically run by local communities, local governments, or in many cases nonprofits in our state. And while that took a lot of effort, we think it was worth it. It helped focus both programs. It helped stretch some of the scarce resources, and that's one of the things I'm going to come back to briefly, but that's one strategy that people in other areas might want to consider. So how do we integrate service delivery? As I mentioned, there are federal programs that can fund housing rehabilitation or deal with health and safety issues that the weatherization program can't. There are also healthy homes resources from time to time available from kind of non-housing federal programs that I think grant writers out there really need to keep their eyes and ears open for those opportunities. And then LIHEAP, I don't think that's discussed enough. Several states supplement their weatherization program with part of their state's LIHEAP allocation. LIHEAP, of course, being the program that provides home energy assistance to low-income families. And there are also provisions to, in some cases, use LIHEAP for energy-related measures, and it's possible I think it's worth having a discussion with your state administrator and local, Health and Human Services to see exactly what flexibility is available there. It's possible that that resource could be used to address some of the issues we're concerned about here. Also, of course, state and utility programs. Many state energy offices have their own energy efficiency programs, and they have to deal with some of the same health and safety issues. Typically, they're a bit more constrained than weatherization. In our state, the energy office is basically NYSERDA. They do a very good job. They have some very strong programs and pretty much mimic the weatherization rules where we're allowed to use a small amount of funding to address energy-related health and safety. Also, the state departments of health and local departments of health should be in the mix and in the conversation here. And then we don't often enough, I think, try to access the private funding networks that are out there. You'll see an example later on in my presentation of where foundations have become involved and had some success. There's also many states have NeighborWorks organizations, or many localities, I should say. That was formerly known as Neighborhood Housing Services. They're very good organizations. Their job basically is to bundle resources for housing improvement and neighborhood stabilization, and this work aligns well with their mission. Of course, organizations like Habitat and Rebuilding Together in some states may also be in this mix. I think it's very important to talk to local foundations and local philanthropic organizations. They exist just about everywhere, and you can't afford now to overlook any source of funding. I think one other, and perhaps the health department people that are on the phone might know better about this. Look at the public health side of things. It's not an area that we in the housing and energy fields are really too used to talking about, but I think a good case can be made for as a public health approach. This is a more prevention is a more cost-effective approach than treatment, so it's possible there may be funding out there, and of course also environmental organizations, including one of the innovative discussions that's been happening lately is on carbon credits, on selling the avoided carbon emissions on the markets. That market is very weak right now, but it's a potential source of funding down the road. And then finally, while we're very cautious about allowing low-income households to incur debt and to to put them in a situation where they're taking out a loan, there may be cases where the work that we do can be shown to have enough of a return to support financing, particularly with rental housing. So that's something to keep in the mix here. Okay, some of the strategies that you can use to grow a Healthy Homes initiative include entering into formal agreements with local partners. Find out who the weatherization and the health department, I'm sure you know who the health department is, the local players on the health side, and there's going to be a buildings department or an office of community development in perhaps your city or county that they each have a different piece of the pie here, and try to meet with them, discuss with them, see if there's a way to reach some agreement to target the funding from each of those sources, or provide certain services to agree to just target a few units every year and coordinate the work. I think it's very important to work with building code officials and community development offices. They know where the worst housing is. They have owners that are motivated that have to address code issues, and in some cases they also have access to resources that aren't otherwise there. And then, the last thought on that is get involved with local planning processes too, such as anybody that receives home and community development block grant funds has to go through a public planning process called a consolidated plan before they can spend those funds. I mean, any municipality, that is. Get involved in that process. Why not go to their public hearing and suggest that they set aside some funds for a Healthy Homes initiative? It can at least, it's a way to start the conversation. Involve state regulatory agencies. There may be actions in your state environmental agency or health department that that can be taken that can help support this. Very important, engage neighborhood groups and landlord associations. That's a natural resource there. Where they may not have the resources, they often have the motivation, and it's just part of the education effort. And then, the important thing, I think, the message to take out of here is to plan ahead and start early in these efforts. You can't just wait until you've got a house with a problem and then go look for solutions. You have to anticipate that you'll have a certain number of buildings in your community that need this complete range of services, and be prepared to assist them before you get with them. I did mention I want to talk very briefly about rental housing. Rental housing provides certain challenges that owner-occupied housing doesn't, and certain opportunities. Many weatherization agencies are maybe more used to dealing with housing owned and occupied by low-income households, but often the worst conditions are in rental housing. In New York State, by far most of our low-income households live in rental housing, and many of them, again, even though you think of New York State as big buildings, and in New York City that's quite, of course, more the case, but throughout our state and certainly many of the other states in this region, typically the biggest health issues and the worst housing and the housing that low-income families occupy are in smaller buildings. Landlords sometimes have little incentive to improve housing in very distressed areas, or if they do have the incentive, they don't have the resources. It's a really tough nut to crack, so I think it does deserve some more of our attention. I think that with the right combination of kind of carrots and sticks, rental property owners can be brought into this, and we can tackle this issue, but it may be difficult. There's what's known in the energy world as a split incentive, especially if the tenants are paying the energy costs, then the landlords have little incentive to invest in energy conservation, other than perhaps it helps them better market their buildings and maintain good tenants. I think this is an area where it's very important to work with the local financial community to identify loan resources for owners. Right now, more than ever, rental property owners are strapped for financing. I don't know if it's the case across the country, but in general, it certainly seems to be one result of the collapse of our housing markets. And that could be a very important incentive to bring owners to the table. Look and see if there are community development lending organizations in your area, or locally based banks and lending institutions. Those are going to be where you have the best luck, I think, with that. Now, in New York, some of the worst areas for housing and health issues are in our upstate cities, and those cities are very often characterized by wood frame, small multifamily buildings. This is in the city of Buffalo. Probably was built as a two-family, but there's 4 gas meters out front, and so this is obviously a house with a lot of issues, but it's looks like it was most recently occupied by 4 families. It's actually typical of a lot of neighborhoods in Buffalo, Rochester, Syracuse, and some of our smaller cities. And this this is a pretty good, I just pulled this off Google Street View, but this is a pretty good example of what our weatherization subgrantees might have to face day to day. Now, I don't know if this house is actually occupied or not. I hope not, given the boarding, but I'm not sure of that. So, and that is a little bit of an introduction to the case study I want to end with. The Buffalo Green and Healthy Homes Initiative was started 2 years ago, I think, after the Community Foundation for Greater Buffalo received a $2 million grant from the State Attorney General's office. The State Attorney General, who happens to now be the governor, was successful in winning a clean air lawsuit. And this funding came from part of the settlement in that lawsuit, and they directed that it be used for energy conservation purposes, which we were very happy to see. But the Community Foundation for Greater Buffalo was very perceptive and realized that the problem in their community was greater than just energy issues. Buffalo has very high, first of all, it's one of the poorest cities in the country. It just has neighborhoods that go on that have been devastated over the years with disinvestment and other issues. It has a very high incidence of childhood lead poisoning. So Community Foundation coordinated with the National Green and Healthy Homes people and the Coalition to End Childhood Lead Poisoning and put together a program with this money and some of the state's energy funding and some other funding to create a Healthy Homes program. They work with, among others, with weatherization subgrantees and other local partners to try to provide whole house solutions. Yes, they address energy conservation, but they're also much more focused than our subgrantees typically are on other health and safety issues within the building beyond what weatherization is typically able to do. And for one thing, they have the ability to spend up to 25% of their total grant on health and safety, where weatherization typically we're limited to energy-related measures and only about 5 to 10%. So this is a great program. It's been difficult for them to to run, as you can imagine, but it's really starting to make a difference in the city. You can see some of the types of lead's one of the real big issues in Buffalo, but also just moisture and neglect over the years. I was glad to see last year our agency was also able to support this initiative. In 2012, even though our funding was down, we set aside $2 million for a competitive request for proposals that that we were looking for projects that met certain priorities. Healthy homes was one of them, also kind of neighborhood revitalization targeted proposals. And we made several awards through that. Several of 4 or 5 of them, I think, were involved healthy homes or health and safety. It included $600,000 through an agency called New Buffalo Impact, who had been a subgrantee for us during the Recovery Act period. They were no longer funded through our regular program. They were one of several that we brought on during Recovery Act. And they were working with a couple of other partners in Buffalo to target a particular neighborhood, the Lower West Side, what they call locally the Montachusett Ave Green Zone, to support Green and Healthy Homes initiative projects by a real targeted focus, trying to cover the neighborhood and deal with everything that's needed in each, or at least address multiple issues in each building. Their outreach partner and their strong advocate for this was an organization called Push Buffalo, who did the literally door-to-door outreach and a lot of other advocacy for this program. And their goal, and they're investing a much higher amount per building in this initiative than they typically would with just weatherization funds. They hope to, we're not quite sure if they'll make this, but they hope to assist 87 units with this grant, which is kind of just finishing up this month, I think. But no, even with this initiative and this funding, we were able to provide, and certainly in general in the weatherization program, health and safety cost limits and the availability of funding are still real barriers to us being able to do this kind of work. And again, more and more, especially as our funding gets cut and we can sort of, we're kind of forced into making choices, we're just going to have to pass by and defer work on buildings with severe lead and moisture and other health and safety issues until we can find better solutions and better ways to coordinate this. So I know I went through a lot of material and did it very quickly. I'd be glad to take questions, or here's information on our contact information and also a link to the Green and Healthy Homes initiative.
Thanks, Tom. So at this point, we don't currently have any questions. However, if our participants think of anything, they can still submit those questions via the chat feature. And so now what we're going to do is turn things over to our next presenter, Mary Giannetti.
And Raymond, I'll quickly introduce Mary by reading her bio. Mary Giannetti has been employed at the Montachusett Opportunity Council, a community action agency serving communities in north central Massachusetts for the last 20 years. She is currently the director of the Energy and Housing and Nutrition and Wellness divisions, including programs such as the DOE-funded Weatherization Assistance Program, an Elder Home Repair Program, Women, Infant, and Children Program, and the Childhood Lead Poisoning Prevention Program. This role offers her a unique opportunity to integrate Healthy Homes principles into these programs and bring together local health and housing partners to deliver services in a coordinated approach that will upgrade substandard housing, improve energy efficiency, and benefit the health of low-income residents. So without further ado, I'll turn it over to Mary Giannetti.
Thank you, Ryan, and good afternoon. As Ryan mentioned, this Green and Healthy Homes project has allowed me to combine two areas that I'm responsible for at the Montachusett Opportunity Council, our nutrition and wellness services, with our energy and housing program. The Green and Healthy Homes project addresses health, safety, and environmental issues. Our project is a partnership between MARC, the Community Action Agencies, our local Twin City Community Development Corporation, and the City of Fitchburg. Fitchburg is a community in north central part of Massachusetts. We're about 50 miles west of Boston, and we have a population of just about 40,000 people. This project was funded by the Health Foundation of Central Mass. And as Tom had alluded, that you may in the past not have considered seeking funding from its foundation that traditionally funds health to do housing rehab. But the connection between health and housing is strong, and in fact you can see from this quote dates back to Florence Nightingale recognizing this connection. Housing affects health both directly and indirectly, either through physical, chemical, or biological exposure, or also can have a psychological effect on one's health. Evidence links housing conditions to health outcomes such as asthma, lead poisoning, lung cancer, CO poisoning, and unintentional injuries. And in fact, our young children are particularly vulnerable as they spend so much of their time in home. The economic impact of the environmental attributed childhood diseases are also great, as you can see from this slide. And not only is there a cost attributed to the disease, but also additional costs from loss of time associated with children missing school because of asthma, and then the loss of work time for their parents who have to stay home and care for the children. We chose to pilot this project in Fitchburg. The Montachusett Opportunity Council serves 30 cities and towns, but we chose Fitchburg because of the high incidence of environmental attributed diseases, and also because of the housing stock. Much of the housing looks very similar to the pictures that Tom showed of the Buffalo housing. And I also just wanted to point out on this slide also how the statistically significant disparities that can exist among the racial and ethnic minorities. So just to briefly talk about some of the Healthy Homes principles and the connection of where weatherization can have an impact in a healthy home. So to keep it dry, damp houses provide an environment for mites, rodents, and mold, which can be associated with asthma. To keep it clean, clean homes reduce pests and exposure to contaminants. Keep it pest-free. To keep it safe, injuries such as falls, burns, and poisoning occurs most often in the home. To keep it contaminant-free, to limit exposure to harmful substances such as lead, radon, pesticides, CO, secondhand smoke. Another principle is to keep it well ventilated. Making sure that there's a fresh air supply will improve respiratory health. To keep a house well maintained, and it goes without saying, poorly maintained homes, there's greater risk for moisture, from leaks, as well as pest problems if there's holes, for rodents to enter. And then a newly principle that was just added to Healthy Homes is to keep it thermally controlled. And as you can, obviously that is very related to weatherization, but also you could see that our weatherization work can address many of these other principles as well. Mechanical ventilation to keep it well ventilated. We can address moisture issues through our air sealing. Just buttoning up any holes can help decrease any pest infestation. And then also to reduce the CO poisoning by making sure that there's properly heating units. So the focus of our Green and Healthy Homes project was to address the older substandard housing units. These units are often those that are occupied by low-income home owners. They don't have the resources to invest into it, or if it's a rental unit, there's disinvestment from the landlords. And then what happens is these families are just left to live in these inefficient, unhealthy housing with very little resources. Addressing these housing was really important for our partners. Oftentimes these are the housing units that are not only burdensome on the residents' health and wealth, but also leads to housing instability, brings down neighborhoods, and also sucks up a lot of community resources. These are often the same homes that multiple agencies get called into. Board of Health, these residents end up in the emergency room. We go in for housing rehab programs. So there was a big interest on all the partners to be able to address these homes. Our approach is that we would make sure that it's comprehensive, that it considers the people living in the home, the structure, and then what some of the potential hazards are. The goal is that we want to, when we go in there, we want to do as much work as possible to prevent any missed opportunities that could be addressed and to provide for a healthier, safer, and more efficient, stable housing. So our model here, you can see, is the three agencies that is working together. Our funding for this project was for the coordination of the work. We did not get any additional funding for housing rehab, so we had to rely on what existing resources existed. So for the Twin City Community Development Corporation, they run a lead abatement program. They also are involved in rehab and rental management. The City of Fitchburg has rehab money in home and community development block grant. And then at MOC, we run the weatherization and home heating assistance program, as well as an elder home repair program. As you can see, we work in silos. Our energy and housing programs, they're managed by different agencies, and they have different funding streams. So what we wanted to coordinate was on a programmatic level so that we could incorporate healthy homes into our current practices. We did this by convening a Healthy Homes Action Group, and our goal was to make sure that we had an assessment form or tool that we could all use that would identify any housing problems. On a systems level, we wanted to be able to coordinate the work and, as I mentioned, leverage what existing funds there was and prevent any missed opportunities. And in the end, hoping that it would improve service for the residents that we were serving. To do this, we were going to pilot 8 projects and build these systems and a way to more easily refer and leverage funding. And then on a system-wide level or a policy change, we wanted to incorporate healthy homes into our local building codes and housing policies, and to also take a look at green and healthy homes construction standards. So we're still in this first year. It's a 1-year grant. We were awarded in October. So what I can do is just share with you a little bit of the details of what the activities were and what our timeline. As I mentioned, we convened a Green and Healthy Homes Action Group. This consisted of MOC staff representing our elder home repair program, our energy programs, and the childhood lead poisoning prevention program. We had City of Fitchburg staff. That included the Board of Health Director, building inspectors, as well as staff from the Twin Cities CDC. We also thought it was really important to keep our funders up to date and also aware of some of the challenges and successes that we were having. So part of this group included the local utility, who helps to fund some of our weatherization work. At the Mass Department of Public Health, the director of the Childhood Lead Poisoning Prevention Program, and then at the Department of Housing and Community Development, our energy director. The Green and Healthy Homes Action Groups meet quarterly, and we also felt that it was important that we offered training so that, and also to subcontract with a professional who could help lead us in this initiative, who has had expertise. So we did subcontract with Ellen Tone to assist us with this process, and we also, the group, became certified in the Healthy Homes Essential Training. So what the group has been working on as we meet quarterly is we first conducted an inventory and got everybody up to speed what the different housing rehab money was available. And then in the second phase, we began to develop a common tool that we could all use to go into a home to help assess, make referrals, and then to develop a partner agreement. And then, as I mentioned, we were going to test this out on 8 projects, and then hopefully then be able to expand this out. So some of the projects that we were looking was to identify projects that had different levels of need. So for instance, a light touch project may come from the Board of Health, and this may not necessarily be code items, but could be things that they've identified that could be critical health and safety items. A more heavier touch project might originate through the MOC's weatherization program or through our CLIP case management, and may involve 3 or more programs that we would have to leverage different funding sources for. And then the third one would be led by the Community Development Corporation, who does large rehab projects. They'll come in and they'll re-gut a home. And they are working with a group called New Ecology to identify standards that they can use going forward around green measures. As we roll out and do these projects, which we've identified the 8 projects now, and the remediation is just starting, but what we really want to do is document the process. What were some of the barriers? How did we work through this? And so after we work through the barriers, so that we would have a system that we would be able to then use and expand to other communities. I also mentioned one of the other sustainability pieces is we wanted to look into our local building and housing codes. So right now we are researching those, and we will be looking for support to go forward to make those recommendations to the Board of Health. And the other sustainability of the project was the protocol, as I mentioned, for working together, and the green and healthy home standards that the Twin Cities CDC will be developing. So the way we'll evaluate our project is by the number of staff that have been trained in receiving the Healthy Homes Essential course. We will be documenting the challenges and barriers, as well as the number of referrals made, and how many of those projects, had we not been doing this, would have resulted in a deferral. We will be documenting our audit tools that get developed between the different agencies. We'll be measuring resident satisfaction to see how they felt about the project. And then, again, did we adopt any building codes to include Healthy Homes principles, as well as the Healthy Homes construction standards being developed, and then any protocols that get developed for interagency collaboration. The program expansion will work. We have been approached by the Montachusett Public Health Network, which is 11 surrounding communities that are boards of health working together. They're very interested in us taking this system, what we've learned, and expanding it to their communities. So we hope through further dissemination of the project at a local, state, and again through national webinars like this, that will continue to raise awareness of the need to coordinate these different funding streams and the importance of working it together. And here's my contact information if anybody has further questions that we don't answer today and would just like to talk more about what our project is.
Thank you.
Thank you.
Thank you. So we do have someone on the webinar today who is working with a Head Start and the Senior Office on Aging organization, and they would like to know if either Tom or Mary have a privacy information release form that they would be able to share.
Hi, yes. We do have a form that is being developed and reviewed between those different departments. And I'm happy to share that if I get the panelist number, if they contact me by email.
Okay. And it looks like that is the only question that we have at the moment. Again, the presenters did provide their email information if you think of something afterwards. So we are close to our ending time. So I would like to thank our presenters for joining us today, as well as our participants for being on the line. Over the next few days, everyone who participated in the webinar today will be receiving an email with links to the PowerPoint, as well as the recorded presentation. You will also be receiving a feedback form that we would like for you to answer, as your responses to that form will help us develop future trainings. Our Webinar Wednesday series will continue next week with Let's Safe Weatherization, and you will be able to register for that webinar via the event page at www.wxplushealth.org. Again, I'd like to thank everyone on the webinar for joining us today.